everyone, welcome back to the channel. I'm your host Ian, and today we're diving into a very interesting chapter of Canadian history, the hospital building surge during the baby boom era. We'll explore how a massive population spike reshaped our healthcare system and influenced real estate patterns across the country. We'll look at the economic magnitude of this healthcare expansion, how it spurred residential growth near those hospitals. If you're interested in how demographics drive economics, politics, and property markets, stick around. This is going to give you a deeper appreciation for Canada's post-war evolution. Let's start with the basics. What was the baby boom and why did it happen? In the years immediately following World War II, from 1946 to 1965, Canada experienced an unprecedented surge in births. Soldiers returned home, the economy was rebounding, and optimism was in the air. Families felt secure enough to grow thanks to steady jobs, rising wages, and government support for veterans. Birth rates climbed to over 27 per 1,000 people, way above the pre-war levels. As a result, Canada's population ballooned from about 12 million in 1946 to nearly 18 million by 1965. That's a 50% increase in less than 2 decades. This wasn't just simple numbers on a page. It was millions of new Canadians needing schools, homes, and crucially, healthcare. The baby boom created immense pressure on the existing medical infrastructure. Before the war, hospitals were often small, locally run facilities, many dating back to the early 20th century. They focused on basic care, like treating infections or injuries. They weren't equipped for the flood of maternity cases, pediatric needs, and general health services that came with all those new babies and growing families. Maternal and infant mortality rates had been dropping thanks to advances in medicine, but the sheer volume of births, peaking at over 400,000 per year in the 1950s, meant hospitals were overwhelmed. Provinces like Ontario and Quebec saw their urban centers strained, with waiting lists for beds becoming common. This demographic shift forced governments to act. Enter the federal government's role in healthcare expansion. In 1948, under Prime Minister Louis St. Laurent and Health Minister Paul Martin Sr., Canada launched the National Health Grants Program. This was a bold initiative to modernize public health across board. A key part of it, hospital construction. The federal government allocated $13 million annually for 5 years, specifically to build and expand hospitals. That's equivalent to about $200 million in today's dollars each year. This was part of a large $30 million package in the first year, covering everything from tuberculosis control to mental health services. The grants were distributed per capita to provinces, ensuring even smaller ones like Prince Edward Island got a share. The impact was immediate and massive. Between 1948 and 1970, when the grants wound down, federal funding helped add around 130,000 hospital beds nationwide. That's 80% of all new beds created during that period. By 1961 alone, approvals had been given for over 90,000 patient beds, plus thousands more for bassinets, nurses, residences, and interns. The number of public general hospitals jumped from 536 in 1945 to 844 by 1960, with total bed capacity rising by nearly 88%. Provinces matched these funds, leading to a construction boom that employed thousands in building trades, architecture, and engineering. Think of iconic facilities like Toronto's Hospital for Sick Children, expanded in the 1950s, or new wings in Vancouver's General Hospital. These weren't just bigger buildings, they were modernized with high-rise designs, centralized nursing stations, and better ventilation, reflecting the era's shift to efficient office-like structures. Economically, this was a game changer. The healthcare sector became a major driver of growth in the post-war economy. Federal spending on these grants stimulated local industries, steel for frameworks, concrete for foundations, and labor for construction sites. It created jobs not just in building, but in healthcare itself as well. Nurses, doctors, and administrators were in high demand as facilities sprang up. By the mid-1950s, healthcare spending as a share of GDP started to climb, from around 4% pre-war to over 5% by the 1960s. This expansion aligned with Keynesian economic policies, where government investment pumped money into the system to sustain prosperity. Provinces benefited from federal cost sharing, which eased their budget and allowed them to invest elsewhere, like education. But the real turning point came in 1957 with the Hospital Insurance and Diagnostic Services Act. This legislation formalized universal hospital coverage, with the federal government reimbursing provinces for half the costs of hospital and diagnostic services. In 1961, every province had signed on, covering 99% of Canadians for standard hospital care. No more out-of-pocket worries for basic stays. This was the foundation of what we've later call Medicare. The Act supercharged the building surge, as provinces now had reliable funding to plan long-term. Cost soared, but so did access. Hospital admission rose by 50% in the 1960s, partly due to the baby boom's ongoing needs. Now, let's connect this to real estate. Baby boom didn't just fill hospital and maternity wards, it triggered a housing crisis. Families needed space, and cities were bursting at the seams. Enter the suburbs, the defining real estate trend of the era. From 1946 onward, suburban development exploded. Fueled by government-backed mortgages through the Central Mortgage and Housing Corporation, now CMHC, low-interest loans for veterans and families made homeownership accessible, leading to neighborhoods like Don Mills in Toronto or Levittown-style developments in Montreal's West Island. Hospitals played a subtle but important role in this residential growth. As new facilities were built or expanded, often on the edge of cities to accommodate land availability, they became anchors for community development. Take Hamilton, for example. Post-war expansions at hospitals like Hamilton General coincided with suburban sprawl in areas like the Mountain or Stony Creek. Families wanted proximity to healthcare, especially with younger children prone to accidents or illnesses. A hospital nearby meant peace of mind, quicker emergency access, and even job opportunities for spouses in nursing or administration. Economically, hospitals boosted local real estate values. Construction projects created temporary booms in nearby housing demands for workers, while permanent staff, doctors earning solid salaries, settled in surrounding areas, driving up property prices. Nationwide, the baby boom added pressure. Housing starts hit 200,000 units per year by the late 1950s, many in suburbs equipped with new schools, shopping centers, and yes, hospitals. This wasn't without challenges, though. Rapid suburban growth led to infrastructure strains, think sewers, roads, and utilities, that all had to catch up. Politically, it shifted power to provincial governments, who managed land use and zoning. And economically, while it created wealth for homeowners, it also highlighted inequalities. Not everyone could afford the suburban dream, leading to urban crowding in places like Toronto's inner city. In wrapping up, the baby boom created a demographic destiny for Canada. It forced a healthcare revolution with billions invested in hospitals that laid the groundwork for our modern system. The economic scale was enormous. From $13 million annual grants to a sector now worth hundreds of billions of dollars. And in real estate, it birthed the suburbs we know today, where hospitals often served as community hubs, attracting families and stabilizing neighborhoods. What do you think? Has this era's legacy shaped your own community's real estate? Drop a comment below, like if you learned something new, and subscribe for more dives into Canadian history, economics, and property trends. Thanks for watching, and I'll see you on the next one.